In terms of the other consultations that we looked at other services that might have been providing dental services, and there is others. And the one of particular note that we visited was in New South Wales, and this particular service is a non-for-profit aged care provider, and their service is getting established as we speak. So in a sense they have been able to combine the service that we envisaged, but they've also got a capacity to manage a larger community because they're actually part of a benevolent group, which enables them to pay dentists or for dentists to actually provide free to their community clients, and so there is a bit of an opportunity there for them to actually work closely with their community. We consulted with the Dental Association in Western Australia around what we should do, what we could do, what potential there should be. All of the things that you can imagine were part of that conversation. Still took us down the road that this might be a viable and of benefit. In talking with the individual dentists, it was interesting, and I'll talk a little bit about that in a moment. The consultation with the individual dentists identified for me the varied practices and beliefs that are in place around how it is that we may get benefit for our residents. And so in a sense, we were in a place where we were listening to a sort of a variety of advice. We actually needed to start sitting down and talking about now what is common sense, what is viable, what is a good business model, and what actually will demonstrate good outcomes for our clients. The outcome was we're going to do a dentist surgery. We planned the specifications for the dental service on site, and we had dental industry advice on what that should be, the space required, and what sort of specifications needed to be included if we were going to put a surgery, with the intention that this would do most of what a dentist might do in his rooms, and that was the intention. So a lot of the discussion that we had after the event, because remembering this planning's all happening 3 years ago when you're putting plans in, getting them approved, getting councils, organising your funding, all of that sort of thing. So those were decisions that were well made then. We needed to build to environment standards, and that was reasonable. The development of the business plan for this was quite critical for us as a provider, and the options of how this might benefit our wider community were also well canvassed around access for our residents that are in our retirement village, access for staff as a staff benefit that they would receive, that we would pay for, that they would receive an annual checkup, all of those sorts of things. And so there were lots of things that were able to be well considered. And at the same time, as all of this is happening, the oral health plan was being investigated a lot further, but then the release of the Caring for Oral Health in Australian Residential Care came out. And so as we were starting to meet with the dentists, we were starting to say, okay, what is actually going to be industry best practice around this, and what is our what is it that we actually are seeking to do here that is actually going to make us the best provider that we can possibly be in this area, and what do we need to do and who do we need to work with? Okay, the current practice in aged care, and I will leave all of this to our next speaker, is really around good assessment, it's around intervention, it's around a proper care plan, and it's around outcomes that are reviewed. And in terms of the aged care recommendations, these actually just sit as part of our normal business in our practice. However, what we understood was that there were areas of this that we probably could be doing better. In terms of the aged care standard, there was a criteria that needed to be met, and I'll let Julie talk about that. What we did was we built a 12.4 square metre space, because that was the advice, but we also put a 10 square metre consulting room next door. We put out a regional consultation for interested dentists, and we did a recap on the current staff practices and the benefits of the service to the facilities and the surrounds. And the business case stood up to build it, and we then needed to understand what sort of a practice would this be for a dentist, hence our discussions with the dentists. In terms of the fit out, it needed to have all of the bits and pieces that would actually make it an effective working environment for the dentist, and that part was actually quite critical, including the occ health and safety issues and also including the infection control issues. And I'll just quickly go through. We spoke with 3 dentists and got 3 quotes about the fit out and the pros and cons. The public letter was very, very interesting. We got a public letter in Perth. We got 27 responses. We met with 5 dentists and determined from those consultations what the better model should be around the modelling of the practice, and then what the scope of the practice might be and the benefits to the facility. The issue that was highlighted through all of our consultations was dentists are going in, they are advising on treatments, and once again in this particular, and I put the 30 out of 115, we had quoted to us a service had gone in to a 115 bed facility, recommended treatment in 30, and none of them had been able to be achieved. So for us this was actually a bit of a damning statistic, and one that we actually wanted to try and improve. And the issue also for us was actually around the funding. The points of issue about this sort of setting this up, we're a private provider, this capital cost is borne by us for the build, and the business model was viable for that. The issues are around the size of the client group in making it a viable business for a dentist, and so we understood this was never going to be a full functioning operating 5 days a week or 10 sessions a week dental surgery in the model that we had proposed, and neither was it ever intended to do that. But it would very well be a model that may support a part-time dentist who is perhaps got a passion for aged care, and I'm very interested to hear that people are looking at the issue of geriodontics, and God, I hope I said that right. So the issue is around staffing. What sort of staff needs to be there? They're coming with a dentist. Do we have to provide them? All of these things are of issue for us, and certainly with the developments that we're talking about here today will be an ongoing issue for us around training. And in defining our model of service, that bit was actually a bit of it was a bit of fun, but speaking with those dentists actually identified really clearly what it is that we should be doing. Our vision was that it would be a best practice in this area, and that is what our gold standard aim is. It is an extra service facility, so these things are important to our residents, and it's important for us to actually be making a good fist of providing it in a very responsive way. The staff training that would need to be a part of this actually does need to address improved outcomes for our residents, as does the resident services and how we set that up. The Commonwealth recommendations around the standards for dental care have an impact in aged care at every level. There is a compliance issue, that impact is significant, and the costs associated with those are just part at the end of the day of aged care. However, I do suggest that when we're thinking about what it is that we're going to be once more asking the aged care sector to do, that we ensure that we've actually got that well and properly supported. So the business needed to have the benefit, the promotion of better health outcomes, obviously. We're looking for this to actually provide a point of difference for us as a provider. We are working in a competitive environment, and our service is one that we want to be proud of and we want our residents to benefit from. We are looking for a much better opportunity for in-reach from the community to provide that normalising of the lifestyle, and as I said before, that the economic position did justify building, and we now are making it operational. Just the future recommendations, just the last slide. For us, this is something that is new, but it is not something that we're going to shy away from. We are interested in being involved in the developments that are occurring in aged care, and would be open to piloting our services if there was the right vehicle for doing this. We are looking to explore funding options for better dental care and aged care facilities, and will work actively with the sector to see where it is and how it is that this may well be able to be achieved. The compliance is an issue, and for us it is important that we work well with our standards agency to ensure that we can achieve what's set out. And I believe that this is an absolutely target-rich environment for research. Thank you.